Stung by a bee? Don't panic, but act quickly. Most bee stings cause pain, redness, and swelling. But in some people, a sting can trigger a life-threatening allergic reaction. Here's what to do right away.
First step is move to safety. Move away from the bee or hive to prevent additional stings. Stay calm and avoid swatting at bees. Step 2. Remove the stinger. If the stinger is still in the skin, remove it as soon as possible. Scrape it out gently with the edge of a card or your fingernail. Avoid squeezing the venom sac if possible. Remember, honeybees may leave a stinger behind, but wasps usually do not, and wasps can sting more than once. Step 3. Clean and cool. Wash the area with soap and water. Then apply a cold pack wrapped in cloth for about 10 to 20 minutes to help reduce pain and swelling. Keep the affected arm or leg elevated if swelling is significant. Last step is to watch for allergic reaction. Now watch carefully for warning signs of a severe allergic reaction such as difficulty breathing, swelling of the lips, tongue, or throat, widespread hives, dizziness, fainting, vomiting, or a feeling of impending doom. If these symptoms occur, use an epinephrine auto-injector immediately if available and call emergency services. Do not wait to see if the symptoms improve.
It is important to know when to seek medical help. Seek medical attention for multiple stings, stings inside the mouth or throat, rapidly worsening swelling, or any symptoms of a severe allergic reaction. At the end, remember a bee sting may be minor, but a severe allergic reaction can become an emergency quickly. Remove the stinger, cool the area, and know the warning signs. Stay alert. Stay prepared. You could save a life.